G'day, it's Peter Massey here, and along with my colleague Lynn, we're going to present some information about influenza the virus, pandemics or worldwide outbreaks of the disease, and talk a little bit about the vaccine. So initially, influenza, it's caused by a viral illness that's easily spread between people. There's a picture of it there in the top right-hand corner. Obviously not that big, they're microscopic viruses, and these viruses can be found in people and pigs and birds, interestingly enough. Influenza A and B are the ones that cause the seasonal flu that we see from year to year. And currently the ones causing trouble in Australia, H1N1, H3N2, that's the subtypes or the names of the ones that are causing trouble at the moment. But also there's some B around, and the B we've seen is Yamagata, I think I've said that right, and Victoria. But it's the influenza A's that have known to cause the pandemics or the worldwide outbreaks of the disease. I've got the flu. That can be heard in many homes and in many Facebook posts at the moment. But not all flu is influenza. Some of it's man flu. Sorry for the men in the room, including myself. Flu, as people call it, sometimes just a cold. I know when people have say to me they've got the flu and they've really just got a sniffle and they can get on with their day, I feel like slapping them around. They've got no idea. When I had the flu, I was out to it for a week or more. I could hardly move. I had the headache and the muscle aches and pains and the tiredness. It was just terrible. I'd get up off the lounge, get a glass of water, back on the lounge, and it felt like I'd run a marathon. It's that sort of illness, influenza. Thankfully, I've only had that once. You can get a cough with the influenza, and the illness itself lasts that 1 to 2 weeks. I got better, and most people do get better from the illness. But influenza can be severe illness in some people, particularly those at higher risk from the complications of the disease. So influenza can be from this mild right through to severe and resulting in death. Hospitalisations occur every year. There'll be people in our hospitals with complications from influenza and people not make it as a result. Worldwide, there's millions of cases of severe disease and hundreds of thousands of deaths every year from seasonal flu. So what do we know about seasonal influenza? Well, the World Health Organization, has got some general information that summarises it nicely. So how to recognise the flu? Well, this sudden high fever is a really giveaway part of it. If you've been getting sick each day over weeks and then start calling it flu at the end, it probably isn't. The influenza develops suddenly with this fever, headache, often a cough and a sore throat, muscle pains, and the tiredness we were talking about before. And what do you do when you have the flu? Well, the World Health Organization recommends, and as do we, cover up your cough or sneeze with your arm or elbow. That's really important. No good sharing your bugs through the room. A big sneeze or cough can spread the virus for metres around you. So cover your mouth up when you're coughing or sneezing, arm or elbow or a tissue. Washing hands, we often cover our mouth with our cough with our hands, and our hands got the bug and the virus all over it. Then we touch a door handle or we shake hands with somebody, pass the virus onto somebody else's hands, they touch their eyes, and they've got the illness. Nice us to spread it. Washing hands can interfere with all of that. So washing hands frequently is a great thing to do. Getting plenty of rest. This is a viral infection, so your body needs some chance to rest to recover. Healthy foods and water, and getting medical advice when you're having breathing problems. But there's some people who can get the disease particularly bad. So who is most at risk from influenza? It's not most at risk of catching the disease, it's actually most at risk of getting the complications of the disease. So this includes pregnant women, Aboriginal people, young children, elderly, and people with chronic medical conditions like diabetes, heart disease, respiratory disease, kidney disease. So many of those situations is your immune system's down and the virus can cause havoc and can end up with complications like pneumonia and other bacterial infections on top of it. Pregnant women, our daughter-in-law is pregnant, and just recently had the flu as well. She was quite sick. We were worried about her. The fever that you can get from influenza can impact the baby. Thankfully, she got through okay, but it can be a really severe illness on children when they're born, young, new ones, and also the elderly, and can really take people out as a result of how bad it is. There's secondary complications. Aboriginal people have a lot of pregnant women in the community and families, lots of young children, and the elderly often have got chronic medical conditions. So you can see that as a group of people, they're more at risk from these complications of the disease. But what about pandemic flu? Well, pandemic means like pandemic, pan meaning across the world. And so this picture is a picture of the world and flu going across it. So it's a global outbreak, a global epidemic caused by a new virus to which there's little or no pre-existing immunity. And so as a result, it can spread from person to person quickly across the world. And if you think about it, you can be in your town today and you can be in London tomorrow. And so as a result, the virus can spread with you right through the world very quickly. These pandemics are impossible to predict, but we keep a close eye out for them. They can be mild or severe, but what we do and definitely know about influenza pandemics is that it'll occur again. We're just not sure when. Pandemic flu, or this worldwide outbreaks, the most recent one was in 2009. You might remember it was called swine flu. And it started in South America and North America and then quickly spread around the world just in a matter of weeks. And we had cases in Australia very soon after. In just that year, in 2009, it caused between 100,000 and 400,000 deaths globally just in that year. I know some people said, oh, it was just swine flu and it was only mild, but the hospitals near where I work, they had patients, young patients in intensive care, young pregnant women on breathing support. For some people, the H1N1 had a really nasty edge to it and caused a lot of distressing illness, including death and disability in people. So pandemic flu spreads around the world. Most often, it'd be the people who are most at risk of the disease, such as pregnant people and oldies and young ones, but pandemics can also impact healthy persons. The H1N1 in 2009 was called swine flu because pigs were in the middle of, they had bird flu, human flu mixed together in the pigs and become a new virus which was transmitted to humans and then human to human, and it was spread around the world. Looking back in history, that type of experience seems to happen 3 to 4 times every 100 years. So just because we had it in 2009 doesn't mean it'll be another 30 years before the next one occurs. It really could be this year or next year, or it could be many years away. But this time, this work that we're doing together now will help us to get better prepared for next time so that the disease has a less of an impact on our families and communities. Influenza is definitely worth keeping an eye on. On the left-hand side is a graph of reported cases of influenza. And you can see that the dotted red line was 2019, and it showed that we had some more summer flu around than normally. But these cases, the people who make it onto this line, they've gone to their GP or hospital, had a swab done for flu, and have had it positive, and those numbers end up on this line. Many people, of course, don't make it through to a GP. They're not that sick, so they just look after themselves at home, so they don't get counted on that graph. So the bottom right hand is another surveillance system or a tracking system that we use. It's called flu tracking. I encourage you to join if you're not already a member. And this is where 40,000 plus people around Australia get an email each week and just check on how they're going, check if they've got flu. And we put together those numbers and can track flu's movement and how bad it is through the community. For many of them who don't make it to the doctors, it's sort of more community type surveillance. Then the Commonwealth Government puts together information about the reported cases, information like from flu tracking, hospital surveillance, ambulance surveillance, and get a bit of an overall feel for the amount of flu in the community. And the top right hand is a bit of an indicator that in April it was minimal risk of flu, as you'd expect this time of year, and that would obviously increase as we move through the flu season. So we do that in Australia, but it's also done in many countries around the world, very similar. And the World Health Organization particularly has a close look at countries where people, pigs and birds live close together, because that's the most likely place for the new virus to emerge, through this mixing of flu between birds, pigs and people. So close look in those countries, watching out for emergence of pandemic flu so that we can get in early to try to control it. Back in 1919, when the terrible pandemic occurred across the world, quarantine was an important part of the control. I'm not sure if this would be acceptable today, as if you've got flu, we put you out in a tent in a paddock and hope you get better. Probably not. But quarantine may have some role, like we mentioned in 2009, H1N1 started in South America, and there were some travel restrictions from South America and pandemic flu-affected areas into Australia. So it has some benefit, but often the disease is spread widely before the travel restrictions are applied. Just as we talked before, people move around the world a lot, and so the virus can go with them before we even know that it's happened. But quarantine, it's got some role. A bigger role in reducing the impact of pandemic influenza on communities is infection control. And wearing masks. I don't know if you've travelled to countries where masks are more normal than in Australia. We don't see many people with masks on here, but it's helpful. If you've got a flu or cold or something respiratory, having a mask in front of you will stop the spread of the virus, and it may stop you breathing it in if you've got it on as well. So masks, they're helpful. The middle picture, I'm not too sure about spraying disinfectant around everywhere. Let's just leave that because I'm a bit unsure of that one. But what we are sure about is that washing hands makes a big difference. So what to do to fight the flu? Wash your hands. Well, people often don't think about that, but washing your hands frequently and well is a great way to help protect yourself and your family, and the family to protect the community. So the more hand washing, the better. We love it. Important aspect of disease control is keeping a distance between the person with an infection and the people who are susceptible. Respiratory viruses don't fly on the wind, they just go on droplets in a nearby location, so keeping people further apart, like the old poster on the right where theatres were closed and public gatherings were stopped so that bigger distances happen between people. It's probably got some role. Picture on the left with an empty school, that indicates probably the most effective thing that we can do about social distancing. Kids love to spend time together and sharing some fun together, but they also share bugs together. And if you've got influenza in the school, it can quickly go from child to child. Closing schools in some communities will increase the distance between kids. Instead of having 1,000 kids in one little classroom or one hall, it's much less, so the chance of spreading it is reduced. So social distancing, it's got some value. Also of some value is antivirals. You may have heard of Tamiflu and flu treatments, and so what this can do is, if you've got flu, is you take the treatment and it reduces how infectious you are and the length of illness by a couple of days. That's helpful. Also can be used to prevent the illness. So if somebody in your family's got the flu and others in your household take this, it could stop them getting the flu. And then we use this also for healthcare workers to help prevent them getting it. It's not fantastic, but it's helpful, and it's part of the kit that we use to improve control of this disease. But the most important thing that we can do for pandemic and for flu is vaccination. Because once you're vaccinated, you develop immunity that lasts for months, maybe years. And then that way, you've got this ongoing protection. You can't take tablets for months and years, but the vaccine will provide some protection. So vaccines are really integral in preventing the spread of influenza and pandemic flu when it happens. Unfortunately, with pandemic flu, it's a new virus, and so it's not expected, and it will take somewhere between 5 to 6 months for the first supplies of approved vaccine to become available. You can see from this figure that the timeline of development, including finding the virus, getting it developed in the manufacturing process and then getting it approved, gives a bit of a lag time. It may mean that the pandemic is well established before the vaccine is available. But if we have those control measures we mentioned in place, it might slow us enough to buy us time to wait, as we wait for the vaccine to come available, which will be the big thing that will prevent the disease in the future. So vaccination against pandemic flu is actually similar to seasonal flu. The protections we get from that are about moderate, so they're not fantastic, but they're not low. So moderate protection we'd expect, and that'll be enough to slow the spread of the disease. The risks of the vaccination are probably similar to seasonal flu, so that we've got good safety record on seasonal flu vaccines. There's common side effects that you'll probably well know if you've had a flu shot. You might get a sore arm, redness and swelling at the site. Sometimes you get headache and fever and nausea, muscle aches. That's just your immune system kicking in, and you haven't got the flu from the flu vaccine. That's not possible. But they're just side effects, and they last just a day or two, unlike influenza effects, which last a week or two. The vaccine acceptability in the community, though, will be a bit dynamic, and it's likely to depend on how severe the disease is thought to be, to how likely people are to want to have the vaccine. So it's going to be a challenging space once the vaccine becomes available to even get people to get immunised. So we'll need to prioritise, unfortunately, with the vaccine, because the vaccine companies can't produce 24 million doses on one day. We'll have a limited supply to begin with. Eventually there'll be enough vaccine to immunise the whole population, but initially there'll be some restrictions on the supply, and so together we'll need to make decisions about who gets the vaccine and why, what we're trying to achieve with the vaccine. And so these couple of days of conversation and deliberation around this are going to be really helpful in advising government about the best way forward in prioritising access to pandemic vaccine. So in summary, influenza can be a serious infection for some people. Seasonal flu, it changes a bit each year, but 3 to 4 times in every 100-year period, the virus makes this big shift and it becomes a new virus, and that can cause a pandemic. That's a worldwide outbreak. Pandemics can be severe. Some things we can do to reduce the impact on families and communities: infection control, the hand washing, the masks, covering up the coughs and sneezes. Social distancing we spoke about closing schools, for example, and getting bigger space between people. Antiviral treatments have a role to reducing infectiousness and preventing infection in people close to a disease. They can slow the spread of the disease, but it's vaccines that can make the biggest difference in the spread of influenza because they provide ongoing protection. The pandemic flu vaccines are very similar to the seasonal influenza vaccines, but because it's a brand new virus, they'll take 5 to 6 months to make after the virus has been identified. And initially, the supply of the vaccine is going to be limited. Eventually, there'll be enough for everybody, but there's some problems in the first months with supply, and hence our conversations over the next couple of days. Hopefully that's given you a bit of an overview of the virus, pandemics and the vaccine. If you've got some questions, I'll be around, or Lynn or Jody will be able to answer those for you. Thanks for your attention.